The question, how do you deal with anxiety and insomnia when medicine makes you anxious? Anxiety is an excessive degree of a normal fight or flight reaction to threatening or challenging circumstances. This response includes preparing the body and mind for a high level of activity, and results in experiences such as racing heartbeat and sleep disturbance. However, the mind and body also has an inbuilt system that has opposite effects on the body, the parasympathetic nervous system. The functions of the parasympathetic nervous system is best described as rest and digest. Thus, the crucial fact in dealing with anxiety is that the body and mind has an inbuilt mechanism for balancing the effects of the fight or flight system. The art of dealing with anxiety and associated sleep disturbance is finding an effective way to engage the natural rest and digest system. In severe cases of anxiety, it is sometimes most effective to use medication to dampen down the activity of the fight or flight system. This might require adjustment of type and dose of medication to discover what works best. In less severe cases, it is often preferable to use psychological strategies to engage the counterbalancing rest and digest system. Even if your anxiety is severe, if medication does not work well enough for you, it is worth attempting to find a psychological strategy that works for you. There are many different psychological strategies. The question of which works best varies between individuals depending on their mental makeup and past experiences. The simplest approach aims to control the physical sensations of the fight and flight response, features such as racing heart. Controlling the physical sensations often reduces the overall level of tension to a level where the mind's own self-regulation mechanisms can function effectively. The physical sensations of the fight and flight system can often be controlled by progressive muscle relaxation and deliberately controlling breathing rate. Cognitive therapy addresses the tendency of anxious people to focus too strongly on the threatening aspects of their experiences. It encourages a more realistic evaluation of potentially worrying situations, thereby breaking the vicious cycle in which the perception of threat increases awareness of the threat in a manner that builds up and gets out of control. In recent times, the technique of mindfulness, based on Eastern meditative practices, has become popular in the Western world. Mindfulness includes focus on breathing calmly and learning to avoid over-engagement with the thoughts that tend to flood into an anxious mind.